I think another lesson that we learned, which we need to speak about more as well, is that public systems, while they have been under-resourced and therefore have all the problems that they come with, like hospitals having staff vacancies, having poor infrastructure, not having the medicines and the diagnostic facilities available, and so on. It was really the public hospitals and the health centers across the country that really did what they could. Of course, given the fact that there have been years of negligence, what they could do was quite limited. But at the same time, I think that is another sort of lesson, that we were able to roll out this kind of vaccination program despite all the confusion. Once the clear message was given that it will be available in the public sector and will be available for free, you saw that that happened, whereas the private sectors, despite being allowed to charge these high amounts for the vaccines, has really failed. However, we see that the government's priorities still don't seem to turn towards these sectors. So if you looked at the budget in 2021, we saw that certain very critical schemes like the ICDS, which addresses young children and pregnant lactating women, school midday meal programs, all these schemes in real terms, the budget, if we compare with 2014-15, has been cut down by 30% in real terms. If we look at the budget for the health sector, we saw no increase in the budgetary allocation last year. And rather, what we saw is again trying to hoodwink people by including a budget for a water and sanitation program within the health budget. Education, less than 50% of the low budget that was allocated being spent, women and child development around 50%, social justice, only 11% of the budget allocated for 2021 for social justice has been spent so far. I think one area that kind of also came out and was highlighted, and which links to what both Chirashri and Sumangala spoke about, is the conditions of work of frontline workers. Where you see that the processes of labor cheapening in industry is something that's happening actually in government also, where you have these newer forms of contractual arrangements where workers are not workers. ASHA workers are called activists. They get an honorarium. Anganwadi workers are called volunteers. They get an honorarium. They are not even considered to be full-time. They're not even considered to be employees, full-time or part-time. Whereas during this period, ASHA workers particularly worked for more than full-time, worked in the nights, visited homes, conducted surveys, did follow-up, did a lot of work, and still do not even earn minimum wages in most parts of the country. Although they did, through doing all this work, also collectivize, they've unionized, and there have been protests, and they've made some small gains, with some state governments now giving them a regular monthly pay. They've not been really regularized anywhere, they've not been recognized as government employees, even when they're doing such critical, crucial work. So recognition of frontline workers as well, as we talk about greater investments in the social sector, is something that's very important.